Hello, Memorial family, and this is our weekly update of what Memorial Healthcare System is doing to address the issues of COVID-19. The governor reopened the state of Florida. However, the Tri-County market between Dade, Broward, and Palm Beach was not part of the phase one because 65% of all the COVID positive cases are coming from South Florida when we only make up 32% of the population in the state of Florida. The governor did suggest that hospitals can begin doing elective work. We will start doing more elective work in imaging, surgeries, rehabilitation, interventional cardiology. We have seen a decline in the number of positive patients coming through our emergency rooms and our different test sites. We felt that it was important to gradually start opening up our facilities. You will also be hearing from Dr. Marks as he can provide more detail as to what are the procedures that we're going to be doing effective May the 11th.
In all of the disaster preparedness meetings, we talk about statistics. And the statistics are extraordinarily important for us in determining whether or not Memorial can begin to open up to more elective kinds of cases. What we have seen over the past week or 10 days is a steady decline in the percentage of positive patients. Additionally, we look at EMS runs, which have decreased related to COVID positive patients, and the number of patients who are seeking care for flu-like illnesses in our emergency room. So all of these steady downward trends are reassuring in terms of us opening up more of our elective services in the healthcare system. COVID-19 patients are being cared for in our ICUs, and they are in COVID units. So all of these patients are cared for by staff and physicians who use personal protective gear at all times to manage those patients. Anybody admitted to any of our hospitals is now tested for COVID-19. If we know that a patient is positive and they're scheduled for an elective procedure, we can defer or delay that procedure until that patient is totally asymptomatic, tests negative, and can then be brought back safely to have whatever procedure it is they need. We test all patients coming in to the maternity unit. We're highly experienced in managing maternity patients, both routine and complex cases. We're ready, willing, able, and safe to take care of the patients in our community. We have been at the forefront of caring for patients in this pandemic, and as we get back to a more normal state of affairs, the healthcare system looks forward to taking care of all patients in our community and beyond.
Memorial is coming back, but gradually. We want to make sure we have a safe environment for both patients, employees, and physicians. And finally, I'd like to wish the nursing team a happy Nurses Week. All of you are participating in a worldwide effort, and that's why we adopted the theme this year of Nursing the World to Health. Thank you for all you do. We greatly appreciate all your efforts.